Have you been troubled with recurrent episodes of severe lower back pain? Maybe this has been happening once every couple of years or so, but more recently it's becoming more frequent. Well, this could be caused by a condition called acute annular tear or annular fissure. My name's Ghosh. I'm a consultant spinal neurosurgeon and founder of the Spine MDT. In this video, I'm going to explain what this condition is and how we can treat it. To explain this, I want to go over what the healthy spine looks like. So here we have a picture of the human spine, the front and the back, and as we can see, it's made up of a stack of bones called vertebrae, which are these structures here. Vertebrae are made up of a block of bone with an arch of bone at the back, and that creates a tunnel in the middle of the spine through which our nerves run through. Then between each bone we have the discs, which are a shock absorber, a cushion if you like, between the two bones. If we take a slice across the spine and look up from the feet, this is the view we would have. So let's have a look at a disc. Well, a disc is made up predominantly of two components. This central nucleus, which is made up of a soft squishy material which almost looks like crab meat when you operate on it, and that's so that it evenly distributes the weight of the bones that it lies between. And then that piece of material, the nucleus, is then contained by the outer layer here, which is several layers in fact, of stuff called the annulus, which is the lining of the disc. And this is made up of material called collagen, and imagine that as almost like cloth fibers that crisscross. Now at the back of the disc, these fibers are a little bit more vertically orientated, so that when the spine is aligned, there's a little bit of a backward curvature in our normal posture. But the trouble with that is this leaves the back part of the disc lining, a little bit more prone to tears. Now these fibers can weaken as a result of being sedentary for a prolonged period of time and a combination of repetitive strain. And often when it tears, sometimes a piece or a fragment of the central nucleus material can leak out. If that pinches a nerve, that will cause sciatica, that's pain radiating down the leg. But often what happens is you have a tear in the lining without any of this material leaking out, but some of the liquid within this space can leak out and generate an inflammatory response, inflammation and swelling around the area that can irritate the nerves, but also just cause localized severe pain in this area. And then over time, eventually that settles down, and that can take anything from a couple of days to a good 3 or 4 weeks. The fibers have weakened over time. It's often a very trivial movement that sets off that acute bout of pain caused by the actual tear through the lining. Your body then repairs this by laying down scar tissue around the annulus, around the lining, and scar tissue, believe it or not, is made up of collagen, the same type of material that the annulus is made of. The disc space itself doesn't actually have a blood supply or any nerve endings, and therefore once repaired, most people are relatively pain-free. Local inflammation leads to the development of small little blood vessels in the area, and as this happens more frequently, more and more vessels develop, and then eventually nerve endings from the main nerve branches start to enter the disc space and can make this whole segment chronically painful. The treatment depends on the diagnosis, and that comes from a very good, thorough clinical history and examination findings. That then has to tie in with a scan if a scan has been done. It's very important to do that first before looking or diving into the scans, because these findings are very common in people who have never experienced back pain. So we have to be absolutely sure that the findings on your scan are definitely the cause of your pain. The first line of treatment should be physiotherapy, with a focus on some strengthening exercises of the spine. And a lot of these exercises have been described by Stuart McGill, who I've also interviewed on this channel, and based on a lot of the research he has done. And it's actually more helpful to do this once the pain has subsided. Now, during the bouts of pain, some anti-inflammatory medications can help ease things or speed up the reduction in the pain levels. But it's best to do the physiotherapy actually when you're feeling quite well in yourself, because that's when you're going to gain the most strength by being able to do these exercises that can sometimes cause pain. But in strengthening the muscles, we should be able to prevent a recurrence. Now, between these episodes of pain, there are other mechanisms that can cause chronic pain that are poorly understood, but a lot of research has been done on this by Professor Peter O'Sullivan. And in this scenario, depending on the findings clinically, I also advise a course of cognitive functional physiotherapy, and I discuss that more in a separate video that is linked below. If scans can demonstrate chronic inflammation around the disc area, and clinically it fits with these nerve endings that I discussed earlier growing into the disc space, then injections to the spine, various injections or denervation techniques, which I've outlined in another video, can put a block to this pain or give you a break in that cycle, and then continuing the physiotherapy techniques I've described can be very helpful. And as a last resort, if all of the above fails, then a minimally invasive operation to just fuse the two bones together can eliminate that level of inflammation. So this is why I believe in a multidisciplinary approach, and that's where we have all the different experts, a surgeon, a pain specialist, a physiotherapist, all bringing their skills together but discussing the patients together so that we can give the best solution depending on what stage you're at with your symptoms. I really hope you found this video helpful. If so, please click that like button and subscribe to the channel. Thank you very much for listening.